Now that we've finished the lower anterior 6 teeth, let's see how it looks. All right, so we can tell that we've opened the vertical dimension from where we had been previously. It was a little overclosed. Now let's take a look at our contacts. If you remember, we had our overbite, but then we had some overjet. And so now we want to look to see how we're getting contact with those lower anteriors. And it's worked out nicely. That guide's been beneficial. The putty guide has been beneficial for us for building up these lower anteriors, because you can see we've pretty much locked in from canine through the anteriors. You can see as we're hitting the marginal ridges, through consistently from canine to canine. And as we've done that, now we look at the occlusal dimension. We can see that we've opened the vertical dimension and that we need to get support of those lower posteriors to support this new vertical dimension. So at this point, I would take my articulating paper and have the patient tap. And I'm looking to see if I have essentially balanced contacts on those lower anteriors. At this point, I'm not looking for it to be perfect. I just want to make sure that it's close. So I might go in and start doing some subtle adjustments so that I'm getting nice, even contacts on all 6 of those lower anteriors. The question I have to ask myself at this point, do I want to make adjustments on the incisal edges of the lower anteriors, or do I want to go to the uppers and adjust on the linguals of the uppers? So a lot of that is based on the aesthetics of the lower anteriors. So I want to make sure that my lower anterior incisal plane is nice and flat. So I can see that I need to adjust on tooth number 23 a bit because it's up a little bit higher. But otherwise, I like it from canine to canine. So where I'm getting maybe a little excessive pressure on this lower canine, maybe I need to go to the upper canine and do a little bit of adjusting there. So the adjusting will be going both to the upper and the lower until I get a nice balanced occlusion on those 6 anteriors. This is a good time to refer to your patient because you'll want to know how that's feeling. Does it feel like it's even pressure on those 6 anteriors? So I'm going to start out adjusting the lower anteriors. I'm going to start out with adjusting number 23 to get that more into alignment with the other incisors because I feel like it's sticking up a little bit higher. Now this brings up a really interesting point, is that the aesthetic view of the maxillary anterior teeth is from straight on, just like this. But the aesthetic view of the lower anteriors is actually at kind of a 45-degree angle. Because if you think about it, if you're speaking with someone, you see their upper teeth straight on, but as they speak, you notice how the lower jaw opens, and this is actually the aesthetic view. So you want to be certain when you're adjusting the lower anteriors that you're being critical about the contour of actually the lingual portion of the incisal edge, because that's in the aesthetic view as the patient's speaking. So this is where I'll come in and I'll use my OS1 burr to shape those, and so I can line up not only the facial edges, but also to line up the lingual incisal margins as well. I'm going to turn the model to the side so that you get better visibility or better idea of how I'm adjusting those, though obviously in the mouth we'll be looking straight on. And you should be able to see by adjusting the lingual portion of the incisal edges how the teeth are starting to look straighter already. If I come back and I do a little bit more on 23, how that starts to line up more ideally as we've brought in the lingual portion of the incisal edges. As we look at the occlusion, we can see we still have contact because we haven't affected the incisal portion, we've only affected the lingual incisal portion. We'll finish doing any minor contouring changes using my ET9 burr. And again, this is just some minor treatment because we're going to be doing the final contouring after we've built up the posteriors. But I just want to make sure that everything's nice and smooth and in alignment.